That work?
That works.
It works.
Okay. Sounds good. Okay, here we go. So listen, I want to welcome everybody to this special series. My name is Kevin Lloyd. I'm the founder of ColumbusBlack.com. We have a very special audience with us today, and we're here to talk about something that's very, very serious that's impacting our community. Before we get going, I want to give you all a little background in regards to what we do here at ColumbusBlack.com. So we are based out of Central Ohio. We are an omni-channel online platform that connects the African-American community, commerce, and culture. So our goal is to make sure that our community is informed of things that are going on. And we also host and highlight movers, shakers, and creators here in the capital city doing amazing things. In light of what has taken place, and we've been around for 15 years, in light of what's taken place, we're leveraging our platform with this particular audience of medical professionals today in order to get some really key and critical information out and some perspectives shared in regards to the impact, the disproportionate impact that COVID-19 is having on our community. We are sponsored today by Mile. Mile is a social activity and entertainment platform where you find things to do, places to go, and food to eat. But this is where you can find your online and virtual events as well, similar to this one. So if you have a virtual event, make sure it's on Mile, because our goal in the midst of all of this is to still help make your life entertaining, because we all know we need a break from the severity of what's actually taking place. But as we move into that severity and the importance of this conversation, what I want to do is I'm gonna actually turn it over to each of the medical professionals that are here with us. There's a great looking group of people on the line today. I'm excited about that, but I also have personal relationships with each and every one of them. And I appreciate you all in very short notice jumping on the line so we can actually share this message that we'll actually get out on all of the media channels so that the word can be spread. So Monica, you happen to be in the top corner, so we're gonna go ahead and start with you and let you tell us a little bit about yourself, your background, so people know who you are.
Well, thank you, first of all, Kevin, for inviting me to be part of this panel. I'm excited to be here today and to have this discussion. My name is Dr. Monica Williams. I'm a board certified family medicine physician. I'm currently here in Atlanta, Georgia, practicing in over 65 age population. I'm a practice medical director for a company here. And our main goal is to make sure that patients who are over 65 or just Medicare patients in general are covered and taken care of in a better way. My other passion is my own LLC, Deep Rooted Health, where I spend a lot of time speaking in the community, serving the community, actually seeing some patients and consulting on preventative healthcare.
Outstanding, outstanding. Thank you, Monica, for that. And obviously with your clients that you deal with, your patients, obviously we take a look at that particular demographic as well from an age perspective. So look forward to hearing more from you shortly. Why don't we go to Dr. Pelt, Alvin Pelt.
Again, my name is Alvin Pelt. I am an addiction psychiatrist, and I practice in Central Ohio, have been here for about 30 years. I have a private practice as well as other revenue streams where I consult with corporations and area clinics. I've focused primarily on treating people with both mental health issues and drug addictions.
Thank you, Brother Pelt. We appreciate having you on the line as well. Clearly, there's some psychological impact to what we're dealing with. So excited to have you on to help us balance that expertise and knowledge as well. And why don't we go to Dr. Karma Brown Warren.
Good afternoon. I'm Dr. Karma Brown Warren, and I'm an emergency medicine physician. Been doing that for the last 19 years. I work here at a level 1 trauma center here in Newark, New Jersey, and my population, 97% is African-American, Afro-Caribbean, and Spanish-speaking. And so I have a direct connection with our community. I also do a lot in the community to make sure that they're aware of their health and also to teach about STEM careers.
Awesome, awesome. Thank you for all that you do. And we pray for Karma often, along with our other medical professionals, but she deals with a lot, obviously, in the hospital. She's in an ER. So we appreciate all that you do in the community as well. And Dr. Chris Brown.
Hello, thank you for the invitation as well. So I'm Dr. Christopher Brown. I am a nephrologist, so a kidney specialist, practicing primarily in Southeast Ohio. Also a health commissioner and medical director for the health departments down in Ross County. In addition, also the founder of thedocbrown.com, where I provide information about kidney disease. Very glad to be here. And of course, just excited to talk and provide education about this very new and very different disease that we have here.
Yeah, absolutely. Absolutely. So appreciate you being on as well, Dr. Brown, with us, especially dealing with the kidney disease component and some of the underlying factors that we know are also impacting our community from a health perspective as they're trying to rebound from this. So, and then we also have on the line, we have a special guest with us by the name of Ed Beavers. Ed happens to be a COVID-19 survivor, and we're blessed to have him on the line. We're excited to have him here, and he's been doing a number of speaking engagements since his recovery. So Ed, thank you. Why don't you introduce yourself, and we're gonna let you lead off, right? So we're gonna let you actually talk a little bit about your situation, and then we're gonna turn it over to some of the doctors to share how they've been impacted as well, whether it's through their personal situations or their professional environments as well.
It kind of started, I had strep throat, which I kind of had strep throat in the past. So I gave me medication for the strep throat. Okay. That was about 6 or 7 weeks ago. From then I got better. Then I went on a ski trip. Once I got back, I just started feeling like sweating. I was weak. So I went to the urgent care. Urgent care sent me home. They said, well, Ed, we think you got strep throat again. Okay. And so we're going to give you this medicine again. Started to get worse. Okay. I started coughing heavily. I had like a shortness of breath. I went back on Thursday. They said, well, Ed, that medication not working, so we're going to change the medication. So, and the medication, by the way, was like $75. Okay. So then one of that month, it just kept getting worse. Every time I would talk, I would just start coughing, vomiting, the diarrhea. I mean, it was everything that you see on that list when you go to the CDC. I think I had it, everyone, the headaches. So we get back to Monday. I go back to the urgent care. Like, I don't know what's going on, but this is not working. Okay. They took my temperature. Temperature was 103. Okay. At that point, it was a nurse practitioner this time that came in. She was like, no, we're gonna call the CDC, and we're gonna send you to the hospital. So because I was feeling good enough to drive, but she was like, no, we're gonna put you in an ambulance. We're gonna take you to the hospital. So she called. She called the hospital. When I told them, prior to that, I did tell them that one of my friends had been to France, and some of the skiers had. So that kind of put them on alert that I was in contact with people that had been out of the country. Okay, so I go to the hospital and I get the tests. They gave me the test right away. I was in the hospital for 7 days. On that Thursday, so they were giving me fluids through my system and antibiotics. On that Thursday, the doctor walked in and said, it was almost like having a conversation with that I've actually heard before. He said, there's really nothing we can do. All we can do is watch you, and all we can do is make you comfortable. And I've heard those conversations before, when the doctor tells you, he was kind and his bedside manner was great, but I didn't want to hear that. So on that Thursday, that's what he told me. On that Friday, it just started turning around. So it kind of flipped. Okay. I woke up that Friday morning and I started feeling better. So it kind of went on from there. So I got out that Monday, and they just said quarantine. There was still nothing that they could say to really do except rest, keep drinking liquids. And so, and I just want to just keep telling people to stay off the streets. Because all this, it just keeps happening. And it kind of upsets me that, you know, I went through this. I don't know how I got it, okay? But it seems like people have to go through it in order to know that it's real. And people think that Black people are not going to get this, and we're getting it at alarming rates. Still see people outside playing basketball and football out in the streets, and then they go home and give it to their parents and their grandparents.
Yeah. All right. So thank you, first of all, for sharing that story. I think everybody can tell we're clearly blessed. He's blessed to be here. And we appreciate you telling that with the authenticity that you did as well, because it is real. That's the reason for this call, right? The reason why we're on the line is we need people to understand, like, this is real and you have to take every step possible, because like Ed said, he didn't expect to get it. You don't know where he got it or how he got it necessarily, but he did. And a lot of people obviously are getting at this point. 18,000 people have passed away as of yesterday, right? So we need to keep them in prayer. And as a matter of fact, so this call also is in memory of Kenneth Wright. So my god brother, that's his older brother, passed away a couple of days ago. So honoring him at the same time we're sharing this message. So why don't we jump into some of the doctors? Anyone want to take the lead on what impact have you seen thus far from your personal experiences or your professional experiences thus far? Like, you're seeing this stuff firsthand on the front lines, which we appreciate each and every one of you for what you're doing in different capacities, but I would love to hear from you all in regards to what you're seeing and dealing with.
Well, I'd certainly like to start out, not being the shy one. I don't have a lot of personal or professional experience because the majority of my work week is in corporate medicine. But I will tell you, an informed company that I work for made this decision about 4 weeks ago. They realized that a part of our policy is that doctors maintain a private practice while we work in the corporate arena in the insurance industry. But they realized that because of our private practice work, as we came back to work on Monday, we would probably be the most infectious employees in the company. So about 4 weeks ago, company-wide, they sent all the doctors home because they were worried that we would infect the rest of the employees and destroy the business. So I've been at home in self-quarantine or socially isolated, one might say, for about 4 weeks. And so I've had a lot of time to look at the media and try to digest what is going on, especially in certain populations. And here is my take on it.
Mm-hmm.
I think that Black people, just like a lot of Trump supporters, do not believe in science.
Okay.
Or as my great grandmother would say, don't believe that fat meat is greasy. So we are at risk because of our beliefs with this global epidemic. It also is reflective on the way that we learn, and the two broad ways of learning to learn new things. One is experience, and the second is by wisdom. Now, I'm sure you've heard this misinformation 1,000 times. Experience is the best teacher. No, it is not. Experience is not the best teacher, because to learn by experience means you have to have a personal experience, and sometimes that can kill you, as in the case of COVID-19. And in some places, like Chicago, Black people are dying at a rate of 7 to 1 compared to white people's. So I think we need to really do a mental adjustment, because we need to be learning by wisdom. We need to be looking at other people's experiences, just like what we've heard from Mr. Edward Beavers. And we need to read, we need to study, we need to listen, and then we need to use that information to make an informed decision. And that will help us health-wise, I think, especially since we are a group that is already high in pre-existing conditions, and especially in diabetes and lung diseases like COPD and asthma. So perhaps Dr. Williams and Dr. Warren can speak more to our pre-existing conditions that makes us more susceptible to COVID-19.
So that's a good segue. Would either of you like to jump in, share your perspectives as well as your experiences thus far?
I think I'll jump in here because I think karma, we see people on different fronts of the line, and I see them right before they get to her. So let's talk about what we do before we get to this place where we are in the emergency room.
Okay.
For what I do on a daily basis, I'm a primary care physician, been practicing for over 25 years. And this has been one of those things that has definitely impacted the way we do medicine. So one of the biggest things that we have done is we've shut down the majority of our clinics. As a practice medical director, though, a few of us have taken on our urgent care. And so what that means is that we are literally taking turns being in the clinics on the front lines, trying to make sure patients who are extremely ill are taking care of themselves at home. We have gone to telemedicine. We have gone to visual medicine, doing visual visits now, and as well as just trying to see those patients who are still having chest pain, who are still having new onset diabetes, who are having new onset hypertension, and getting those in, and while protecting ourselves because they too could be carriers of COVID. And so we are, taking care of those patients. It is absolutely true that patients are sick, and they are sick at home. They are sick while they're walking the streets. Here in Atlanta, it is amazing to me how many people are not walking around with masks. It is amazing to me how the usual Atlanta traffic that came to a sudden stop a few weeks ago now is moving quickly and quickly to being more active, and my drive to work has become even more slow again. Wow. And that just surprises me, because that means that people really aren't taking this as serious as they could. Now, and this is not just us though. So let's say that too, because I live in Lawrenceville, and I'll tell you, when I go to the supermarkets out here, I see even less masks than I see in the inner city, which to me is interesting too, because once again, because of the disparity we hear about now with it's in the 70% in the African American community. Okay, so it's not us. So if it's not us, then, we're okay. It's their disease. And I think we have to be very careful about that as we move forward too. Because once the spotlight is off of other cultures and it's just on us, things really slow down a lot. And I know we'll talk about it as we move forward, but so what does that mean to us and for us about how are we going to take care of ourselves in the midst of all of this, and how do we move forward? But all of these things that he spoke about, diabetes, end-stage renal disease, people on dialysis, people with asthma, obesity, hypertension, they're all things that we definitely need to be talking about. We've been talking about them, but it's now time to start really talking about what we're going to do about it.
Yeah, and that's great, because one of the things I want to do, before we wrap up, is talk about what do we do differently, right? So thank you for sharing that, giving us some background so we understand how you're helping your current patients, but also what you're seeing. And then I love the overall thought process, right? Like, we have to be cautious of how this becomes titled, right? Because COVID-19 is not a Black disease, or a Black virus, right? So thank you for sharing that as well. But it is obviously clearly impacting our community. So, Carmen.
I'd just like to jump in. I mean, building on what Monica talked about, I have a very different experience. One, because I'm in the emergency department, and what I do is I see the patients at their worst. So I'm seeing every day, all day, every shift, the patients at their worst when they can't breathe, when the virus from COVID-19 has really taken its effects. I'm seeing the patients that need to be intubated. I'm seeing the patients that are admitted into the emergency department, cannot have any family at the bedside. So I'm having to deal with the family who cannot be there for their ailing member. Everything for me is a little different, only because they're coming at the end. I see it happening only to our community, one, because that's the type of patient population that I serve. But I also see it more because, and they're having more effects on them because they're coming with coexisting conditions. And we see these coexisting conditions in our people mostly, diabetes, asthma, heart disease, hypertension. Those are the things that you see that are prominent in our community. So when the patient comes to the emergency department, they're more sick. And why they're starting to get the label that you see it happening more in the African American community. It's not necessarily that it's a Black thing, it's a white thing. It's just that a lot of us are not as healthy compared to our white counterparts. So when you see it, you see the worst of the worst happening in our community. And that's what I see every single day when I go to work in my shift. Now, I don't necessarily have anyone in my family that has been diagnosed with COVID-19, but my husband being the mayor of our town in a predominantly low income Hispanic Black community, we do have high numbers in our community. So I'm very aware of how it's affecting us, not only from my job, but also from the community.
Thank you for sharing that. And that's one of the reasons why we definitely wanted you on with us, right? Because of your firsthand engagement with this. Every shift, every shift, no matter when you work, you're dealing with something from a trauma perspective, right? That's first, that first touch. So we appreciate what you have to share there, and we'll be coming back to you in a minute.
Let me just say something.
Yeah, go ahead, Kay.
With the emergency department right now, because we're on the East Coast, New York, New Jersey, Connecticut area, people are taking it a little bit more seriously than I have found in the South and some other places, especially Florida. I mean, these people are still on the golf course. Right now, you can go to the grocery store here and people have on masks because they're scared. But now I will admit that our community is not taking it as serious until they start to have somebody in their family that's being affected, or a friend, a family member, somebody that's very close to them, because they're dying.
Yeah.
People are dying left and right. When I come into the emergency department, the entire ER is admitted with COVID-19 patients. I don't even have rooms enough to take care of the regular emergency department patients that come in anymore because everybody has COVID-19. So, I think the East Coast is a little different in that sense. Okay. More people are afraid, and New York is scaring the heck out of most people. Because if you're watching the news, New York is overrun. I mean, it's crazy, and it's spilling out into the surrounding areas, which is obviously Newark and others like that.
Yeah. So, Carmen, for those Dr. Brown, for those who don't know how close Newark is to New York City, how far are you away in minutes?
On the train, 25 minutes.
Yep.
And driving, because of the traffic and tunnel, probably about 20 minutes. So it's right there.
All right. So yeah, very close in proximity, and obviously seeing some of that impact spill over. So Dr. Chris Brown, so based on everything that you heard, what are you, especially as a health commissioner as well, like in playing a part in making big decisions? Obviously here in the state of Ohio, we were very aggressive under Governor DeWine. So took a lot of measures to try to slow this thing down. And obviously you've had an ability to have some impact and some input, but what's your perspective? What are you dealing with, so we understand that as well?
So I think, kind of like everyone else, kind of see what we get on the media in terms of like how it's affecting African Americans and the disproportionate numbers. And interestingly, kind of like Dr. Pelt said, initially it was, the message was that, Black people couldn't get this. And now we got this messaging that we're, suffering, significantly disproportionate numbers of the factors. I think, though, in order to put this into a proper context, or from a population sort of look, you have to think about, what this disease is and how it's spreading and things of that nature. Number one, I think that, in terms of, its acceptance by, a number of communities, not just Black communities, we're talking about the Black community now, but like I said, a lot of other communities. I think that, a lot of people don't understand, logarithmic growth of a disease. They think more of a linear fashion, so that if we see 10 cases, this week, we're going to see 20 cases next week, and they can't really conceive of a disease that spreads as fast as this particular disease spreads. Also, because of the number of asymptomatic people that carry this, there are going to be a lot of people that have this, and the young people who already think they're invincible feel like they can go on spring break and not worry about things. And a lot of times they just don't think, and they don't think about the fact that they can carry in and infect someone else. It's just not there. If you just think about their thought process, that's just not what they do. The other thing is, this disease is one that's carried by, droplets from people that are close together, by, touching things that are contaminated. And so, so population density has to play a role in this as well. Mm-hmm. So when you think about the things that help spread this disease, and then you think about the people that are most affected by the disease, which are those comorbidities we talked about before. And then you think about where Black people live. I mean, you have a almost perfect storm for this to affect us. I mean, they're like, oh, it's like 90% of the victims in Detroit or, a major city. Well, we congregate in urban areas. So, I think we made the mention of, I think Dr. Pelt said, the Trump supporters versus the, Black folks. Well, if you're a Trump supporter, you're in a rural area, there's a de facto social distancing that happens when you're in a rural area. You just won't see that many people. So even if one person comes in, like I said, unless that person is really in contact, maybe at the local, say Walmart or something of nature, that person may not come in contact with a lot of other people. But let's go to the example of New York. Think about this. Somebody in New York gets on a subway and sneezes.
Right.
During traffic.
Yep.
You've infected a lot of people at that point in time.
Exactly.
And so not only that, when, even, like you said, with Ohio, we shut down early. But that, the essential workers for Ohio can get into their car and drive to the hospital.
Right.
In New York, you don't have a car. You have the subway, which continue to run.
That's right.
And who's loaded on those subways? It's a lot of folks that I would guess it would probably look like us.
Absolutely.
And so you look at that, and like I said, you see really a like I said, this perfect storm. And that's before you even get to the, our perceptions about, healthcare and the fact that we have, we've historically had, we're kind of distrustful for really authority in general. I mean, healthcare in general, but like, or healthcare in particular, but authority in general. So, you got someone on TV telling you that this disease is going to affect you. You ain't seen nobody with it. Like I said, what do you mean? This thing is over in China. I ain't got to worry about this. I'm going to play ball with my boy. And then on top of that, so what's our methods for attacking this disease? Okay, so we got social distancing, and which requires you, right now, like in Ohio, what are we supposed to do? We're supposed to stay at home. Well, okay, I'm in a 4-bedroom house. I got a yard, the whole 9 yards. Right. I don't mind staying here for a couple of weeks. Yeah. But can you imagine being 5 people in a 2-bedroom apartment? And like I said, and then lock down your basketball goal. That yet again, it's the places where we have a tendency to be. We have factors that are going to make our coping with this disease a lot worse.
Well, you're right. I mean, part of what this disease has done is highlight the social determinants of health that are already affecting our people, right? So for the most part, is an environment that they can't social distance like so much easier like the rest, right? They have jobs that they can't say, oh, I can stay at home and not go to work tomorrow. I just stay at home because I have, money to take care of that. Or I have enough health insurance from the beginning, from the beforehand, which is why they already have the coexisting diseases, because they already don't have great health care. So what it's doing is highlighting already the ills of our community that has become now just a big megaphone as to why they're not doing that well.
Exactly. I definitely agree. I have had to write notes for patients of mine who are still being expected to attend work. And guess how they're getting there? Public transportation. And no, they are not practicing social distancing 6 feet apart on a public bus. They're saying that they are, but my patient is sitting there telling me. So as a health service, I'm writing you that note that says you can no longer go to work.
Right.
which should not have to be done if the mayor has already made a public acquisition that everyone is to stay home unless you are an essential worker. Well, he's not an essential worker, but guess what? McDonald's, Burger King, all of those places that get to stay open, they're like, we're not essential, but we're open. And so if we're open and you want your job, you show up. And if the way you show up is through public transportation, and then people have to understand that those same people are serving you your food.
Food. Thank you. Thank you.
And they're just trying to put food on their table. We have a much bigger issue than anyone is really thinking about. And we need to definitely address it. And we're going to have to address it ourselves because we're not understanding, the public is not understanding the impact that it's having on a daily basis. People are dying. People are living with people who are dying. I have patients who are living with husbands, sons who are in the ICU and asking me, what do I do? Can I get tested? You know, this is happening every day.
Yeah.
I agree.
It's real. It's real. So I want to add to that the experience so that people understand the difference. Because I've even heard, and I haven't had these conversations directly, but I've heard people who may live in a suburban area make comments about other major markets, right? Like in New York City. And the bottom line is, unless you live in those environments, you don't quite understand. I was fortunate enough to go on a trip. So I'm in Ohio, drive in my car, go downtown, I do what I need to do. I get back in, I head home. I went home to go visit my mother at the end of February. And immediately, and this was before it really took form, I immediately sensed the difference, right? When I'm on the train and I'm around all of these people, and there's like all of a sudden, and you see a couple of people at that time that had masks, and it hit me hard. So it's easy if you're not in that environment to not necessarily understand why it's impacting the community the way that it is. And once again, that example was good. If you live in an apartment, 2-bedroom, 3-bedroom, and there's 4 or 5 or more people in there, you're going to spread it. And that's going to happen. And unfortunately, those underlying issues are definitely hurting us tremendously. So saying that, there's a lot of real talk that just went in there. So I appreciate it. That's what I was looking for, right? We need to get to the root cause, right? So the root cause as to why we're being impacted the way that we're being impacted. Now is the thing of, what do we do about it? So what's the resolution to it? And I know it's not an easy answer, but in your perspectives, knowing where we are and knowing that there's all this institutional stuff that's underlying, knowing that we have these ailments and these diseases that we're battling, but this is where we are, right? So what do we do? What does our community need to hear, need to know, need to do differently to help try to slow it down as much as possible, knowing we have all these odds against us right now in regards to these particular environments?
So this is Dr. Pelt. I think if you look at the whole picture, it can seem overwhelming. And one of the things that I heard from the other speakers is that it hits the Black community especially hard, but for reasons that has to do with socioeconomics. I think about my 3 sons and their wives. Everyone is college educated, and everybody has a skill set and a corporate environment where they can work from home. How great is that? So, but we know that Black people with college degrees is still unfortunately fairly rare. So most of us, and I come from a blue collar working class family, most of us are working in areas where you can't take your work home. So you're still expected to go into a dangerous environment. So having said that, one of the things that we can do is we can go for the low hanging fruit. So if I can't change the environment, the external environment, can I change the internal environment? So can I reduce my risk of pre-existing diseases? Because COVID-19 is just a wake up. And it is not just going to be this year. It's going to be next year, the year after that, just like the regular flu. So we're going to be exposed to this virus or another type of coronavirus going forward. So how do we build ourselves? How do we eliminate some pre-existing conditions? So in my years of working with patients at a methadone clinic, I saw a lot of people at the lower part of the socioeconomics. One big thing that we can do that we still do a lot in our African-American community, we can quit smoking. There are 2 or 3 different medicines that is easily accessible by your primary care physician, your psychiatrist, your addiction medicine doctor, your nurse practitioner. We can get on some of these medicines to help us quit smoking. If you're still buying cigarettes on a regular basis, acting like there's nothing wrong with it, acting like this is normal behavior, you're going to have asthma or COPD. And when these respiratory viruses hit, you may not be there to see your kids grow up. The second thing we can do is we can stop the behaviors that are producing diabetes. And in my experience, the number one factor that is creating diabetes in the African American community is sugar drinks. Sugar drinks. Or if you're down south, they call it soda. If you're up north, they call it pop. All right, so a 12-ounce can of soda pop is the equivalent to 10 teaspoons of sugar. Now think about that. 10 teaspoons of sugar every time you drink a 12-ounce pop. I rarely see anybody drinking 12 ounce anymore. It's 16 ounce or 20 ounce. So just drinking pop every day is increasing our chances of developing diabetes, along with drinking juice, which we were taught was a healthy thing to consume, along with drinking sweet coffee and sweet tea. Those are the things that increase our chances of diabetes. And when you have diabetes, your chance of healing goes downhill fast. So COVID-19 is a viral infection. If you need to heal from it and you have pre-existing conditions, you are less likely to survive.
Well, I want to also jump in here because this is kind of what my practice has been about from the very beginning. As a student at Meharry Medical College, prevention was what we stood on, and prevention with less. And for our community, that's one of the major things that we have. Not everybody has the resources, but I will say a college education, for me, in my experience in medicine, has not guaranteed anyone prevention from diabetes, hypertension, or obesity. Honestly, the more money you have, the more access you have to the ills of our community and society. So I have not noted that a college education necessarily makes you a healthier person. You should have access to health clubs and things like that, but you also have access to the better restaurants. You also have access to more junk food, better junk food, higher paid junk food. So that does not necessarily prevent this. What I have noted makes the change is group mentality. You either have a group mentality for positive or a group mentality for negative. What I believe will make the change in the future for our community, as it has for other communities, is that we all decide and we all say, you know what? I don't care if you're big, small, tall, however, come with me, come outside, come exercise, let's shop, let's decide to do this together. Hey, listen, right. What you're eating right now is not good. That's not how it works. Go to a class with somebody. Go and engage with someone in a better health activity. We have so many things and people who are out here. I have a line sister, Latasha Lewis. She works in the community of Decatur, changing millions, I don't say millions, but hundreds for sure, of Black lives. You see every shape, form, and fashion, and they're dedicated. Why? Because she's in there, and they're in there, and they are dedicated. They would say Black folks don't work out. We do. We do care about our health. We do care, but it's usually in the same group mentality as we are in the negative. So I think it's going to really take us in a very group fashion. We've got Healthy by Homecoming. When people come together for one cause and someone is encouraging them and pushing them along, showing examples, showing them how to cook something different, saying, come on, it's okay, you fell out the wagon, come on back on. That's the way we're gonna make this difference, because we've been preaching sugar, diabetes. I've been preaching it my entire career, and everyone we talk to, it matters, but how we're gonna make this massive change is gonna be a group mentality. We're gonna have to use peer pressure. We're gonna have to say, come with me. I know, it doesn't feel good, but we're gonna do it together. And that's how we're really gonna make this change.
I agree, Monica. I think those who are already adopting the principle of healthy living, healthy eating, exercise, has to reach back and grab somebody else, because as long as we just continue to keep it for ourselves, and those, because you already hang out with those who already have that mindset of making sure that they're healthy and eating right. So now go back to the community that doesn't have that doesn't know about that. And that's what you do, is create programs that are educating the community more about that, not necessarily hanging with your same crew, because that will make the difference.
And without judgment, that's the other thing. You don't have to look the part to take part in this.
Absolutely.
You've got to meet them where they are.
Absolutely. And if that means just walking around the corner right now, guess what? You just walk around the corner. If that means that you're putting down that soda pop for just one meal, and then it becomes 2 meals, and then it becomes 3 meals, as long as the mindset is about changing, that's where the change starts.
Absolutely.
Outstanding. So real quick, and we're gonna go to Chris, but that reminds me, so y'all know we have this hashtag that's out there, right? We're in this together, and people are using that all over the world. And in this case, this is one where I think for our community, right, we really are in this together. We've got to help each other. I think that's great wisdom, great insight. And we do have to reach back and help somebody else who is not active, who's not eating the right way, who's not working out, exercising, not taking 5 minutes a day. Definitely want to get to the 30 minimum, but not even taking the 5 minutes to actually do something to be active. So thank you for sharing that. And hopefully everybody can take that away. That's gonna be one of our majors for today. Chris, we're gonna come to you. Go ahead.
Okay. Yeah, I mean, I would reiterate just what everyone else is saying. I think that taking ownership of the kind of the health problems within our community in terms of the activities that you've already mentioned. A friend of mine actually mentioned probably a couple of years ago that, you can't fix a problem that's not your own. And so when that health problem becomes our own, like I said, we're able to fix it not only on an individual basis, but also on a community basis. However, I think that, kind of when we mention these social determinants of health, I think as those individuals that, probably would have fit in what we call the talented 10th, of the African-American society, also have to think in terms of, other issues that affect our community. And I think, Kevin, you're kind of doing this now in terms of like introducing us to more entrepreneurial activities, because as we mentioned, what are some of the issues that people are facing now? Making sure that the housing is secure, making sure that their employers are allowing them to have time off. If more of us own more businesses, if more of us own more housing, then like I said, we will be much more sensitive to the needs of that community, as opposed to it being someone that's in a corporate job, or maybe they're the janitor, and like I said, that person is not thinking about their health. And it may be something simple, like in this case, making sure that thinking about the janitor, making sure that they have a mask for whenever they're doing their activities. Right. Or being more sensitive around, hey, maybe we need to let that person stay off, and like I said, get us somebody else that can come in there to help them out and things of this nature. So I think that it's multifactorial. So I think that, thinking about the health issues in and of themselves, but not forgetting that those health issues sometimes come because of the environment that they're around. And like I said, the more that we can input or control the environment that they're around, then like I said, we can eliminate some of those issues, or just reinforce them. I mean, like I said, if we have like I said, say that there was a group of 10 people, they own a neighborhood, and make sure that there's, like I said, that the places where they live have enough space, making sure that there's a place that has a park that's kind of healthy. Those things are things also that I think could help, kind of in the long run, in terms of helping us from a health standpoint.
Community gardens, I mean, things like that, things that we used to do in the inner city. I'm from Philly. Community gardens used to be something that we would do to get everybody involved if you did not have a grocery store that was close to you. Those are the kind of things that we need to kind of be bringing it back into our communities. They're fun, they're good activities for children, they're good activities for families, but they also teach you how to grow your own foods, teach you what's important.
Where your food came from.
Where your food came from. It doesn't come from the supermarket, it comes from the ground.
Right.
all important stuff. Hey, Ed, it looks like did you have something to add in? I think you're on mute. Hold on. Let me get you off mute real quick. There you go.
I want to pop in about the socioeconomic part about it. I'm a financial planner, and I'm gonna tell you, people who have gone to college and have nice jobs are the worst savers. So when things happen like that, they don't have any savings. I've actually found that a person that makes $40,000 to $60,000 saves more money than a person that makes $100,000. But by the time they get to retirement, they may have a $500,000 to $600,000, where a person that's made over 100 may have $30,000 to $40,000 saved for retirement, and they have to keep working. Also, when you talk about how much things cost, a bag of chips costs 25 cents, and that's what most of our, so the kids walking to a store, or even parents walking to a store, they'll buy 10 bags of 25-cent chips. Now later that are 25 cents. Those juices are 50 cents. So when you talk about health, income levels plays a major part in that. And then you have the workers who work at McDonald's and Burger King. What do you think they're taking home since they're not making that much money, what do you think they're taking home to their kids? McDonald's is free. When they Popeye chicken, they take home the chicken that's left from the day and they take it home to their kid. So I think it's more of an income level more than the education part of it. I think it's like when you don't make a lot of money, you don't have as many choices.
Well,
I
I
want to
Go back to
I think we all have something to say on that.
yes, we do.
When I was working, I've lived in Houston, Texas, like I said, from Philly. I've worked in all of our neighborhoods. I've worked in small towns in Louisiana, working with our community. Economics has a role in it, but what's most important is, what do you do with your economics? Honestly, a head of lettuce can feed an entire family. It's what we learn how to do. Diabetes is as much genetic as it is what we learn how to do. We do exactly what we saw being done. They used to feed an entire family, cooked at home from what they bought in the supermarket. So economics has something to do with it, but it's education and mindset more than anything. If you don't know how to go to a supermarket and pick the right things that are inexpensive, to make a salad to feed a whole entire family, to put some carrots in a bag, you believe that bag of chips cost you less. You're still hungry after that bag of chips. You're not still hungry after you eat some food that's been made. And that's what used to happen when you didn't have a lot of money. You made your food at home and took your food to work, and you ate leftovers. Kids today don't want to eat leftovers. People today don't want to eat what they have at home. It's easier. So that's a mindset also. We're talking about real change. We're gonna have to start thinking about changing the way we've decided to make excuses or reasons why we can't afford to be healthy, because it's just not true. You might not be able to afford organic from Whole Foods, but you probably can't afford organic from Walmart.
I'd like to just jump in and add on to what Dr. Williams was saying. It is both, and going back to Mr. Beavers, it's both. It's both economics and it's mentality. I'd like to give you two quotes and an example of how this works. Quote number one: you can't fix a problem with the same mentality that caused it. And I think that is attributed to Albert Einstein. Quote number two: free your mind and your ass will follow. That quote is from the Funkadelics, 1970. So here's the example. When I open my private office up here in the suburbs, treating people with resources, while I worked at the methadone clinic in the inner part of the city, I wanted to be exclusive. So a few years back, I used to give people pop when they walked in an office. We had the scented candles, we had the jazz music playing, and we had the beverages. You could get Coke, Pepsi, Mountain Dew especially, and I had a couple people that crave Orange Crush. And I had it in the refrigerator in the back, and my receptionists and office managers will offer it to you because we wanted to take your cash money and make you feel special. Then I started to realize I had a personal experience where I couldn't run anymore, and my weight ballooned, and I was drinking the Mountain Dew just like the patients.
Mm.
And I had to do some education, and that's when I found out that a 12-ounce can of pop is equivalent to 10 teaspoons of sugar. So once I freed my mind, my behavior had to change. And I weaned all my people off of pop. We do not offer pop in this office anymore. There is black coffee, no sugar, no cream, and there is water. You can drink all the water and black coffee that you want. And so, and then I had to work with people, helping them understand why pop was bad. You know, and I had to have analogy. So without changing people's mentality, whether they're rich or poor, you don't tend to get behavioral changes. You know, so just because the doctor tells you to do it, we've been telling you not to smoke for the last 50 years. But unless you show people why and connect dots together for them, you're not really going to change their mentality by telling them what to do. And you're not going to see behavioral change without really getting into people's head and helping them understand that changing the mentality is what changes the behavior.
That's what I think the COVID-19 is doing, though, in some ways, fashion, because it's affecting so much of the African American, Afro-Caribbean, you know, Spanish-speaking community. Because so much of this exists, they are now seeing that they are having more of the effects than other races. And so my hope is that from out of this, when we finally get over this hurdle, that we will be able to see, why did it affect my cousin Juju more than it affected my friend Karen? You know, why it affected Juju? Because Juju had diabetes. And Juju had other medical problems, including renal disease, which put him at a further risk for having such the biggest effect. So my hope is that a lot of this will help them to see it, because they do need to see differences. They don't believe it, just like they don't believe stay at home unless you tell them. And one of the things, unless you tell them it's a national emergency, a national quarantine is recommended. You know, I'm good. It's not really going. I'm straight, you know, and until you see that it's affecting more of your family and affecting the people that you see is when you can really understand how serious it is.
Wow. All right. So here's what we're going to do, right? Because this is an amazingly healthy, right, conversation. Yes, pun was intended there. And we could definitely do this a lot longer, but I promised that we would do a 2 to 3 o'clock. It sounds like we may end up doing another one based off some of the comments. What I do want to do is there were a couple of questions out there, and I want to make sure we give a couple of answers to these very briefly. But there was a question about, let's see, there was one about working out, right, from a cardio perspective outside. Let me see if I could get to that one. What's the recommendation for those who do want to work out and want to work out outside? From a cardio perspective, as long as they do the social distancing, that's recommended. Any other additional points on that?
I want to definitely
add
to that. So we absolutely want people outside working out, but I do see that the social distancing part is a problem. They've recommended that people stay 6 feet apart, but there have been some studies in China talking about exactly how this molecule actually does linger in the air, possibly. And I think that we have to be very, very, very specific about when we are going outside, that you're not just taking 6 steps away from someone and jogging, because as you jog and someone is coughing and you running into their respiratory droplets, that's not really social distancing in the way that you think it is, because you're outside. So I want you to be in an open space. I want you to really be far away from people. If you have a backyard and you're blessed enough to do that, do it in your backyard. If you do have a neighborhood, just make sure you really are not just standing in a circle around people and so that you're passing the virus back and forth, that you really are giving ample distance between, because respiratory droplets, they definitely fly further than what I think people are aware of.
Okay, thanks for sharing that. Good stuff. So real quick, why don't we do this? So last thoughts from everybody real quick, because I'm going to jump on another call. And I want everybody to notice we do have another friend in our Tuskegee University circle and HBCU circle. Her name is Maya Dyson. So we showed the hashtag when we did the invite, prayers for Maya. So she's in ICU in Atlanta right now, and we're praying for her restoration of her health because she's been in for some time now. But fortunately, she hasn't been going the negative way recently. So we're hoping that she starts to turn a curve the positive way. So please pray for Maya Dyson, as well as all of our medical professionals that are out here firsthand doing what they're doing to help save our lives. So we appreciate everything that you guys are doing. But around the horn real fast, any last tidbits or thoughts for our audience that's going to see this video? And we'll start with you, Dr. Brown.
Okay. I would say just, for everybody that's out there listening, the COVID is real. This disease is real, is unpredictable. And so I definitely advise that you take this very seriously. The social distancing is super important. Washing your hands, make sure you make a ritual out of washing your hands or using hand sanitizer, because that is the, other than inhaling, that's the other way that this disease gets inside of your body. You take your contaminated hands, touching either your eyes, your nose, or your mouth, and that's the way this gets in. So, like I said, take that information very seriously, and maintain the social distancing, and also maintain your psychological health too while you're on social isolation, and just try to find ways to make this as productive or relaxing as you can during this time that we just can't really predict a lot of things that's going to happen.
Thank you, Chris. Karma, would you share your last tidbits?
Sure. I sign everything Dr. Brown said. I think in general, stay at home as you can, as much as you can. Keep those masks on when you go out. Keep the social distancing like you talked about. Wash those hands, keep them away from your face. Change your diets as best as you can. Start incorporating some more healthy eating, fruits, vegetables, and also exercising. 30 minutes a day, 3 times a week at minimum, even if it's just to walk around the block by yourself. And I think we can flatten the curve.
Thank you. Definitely will keep you in prayer as well. All right. Good stuff. Dr. Pelt, last
Yes.
Go ahead, Dr. Pelt.
Yes. I would say believe in science, because what you don't know can hurt you. When life gives you lemons, make lemonade. And the way I'm doing that is I'm learning to do video chats. I'm learning new technology with this downtime. I'm connecting with family members, and I'm building relationships that I would not have built otherwise, because I've been too busy doing money generating things. So now that I have more time available, I'm learning to use the technology that is connecting me socially with other people. I'm doing more exercising in terms of walking, doing the stairs in my condo building, and I'm spending more time with my wife as we do daily walks. I think she's a really nice person that I'm just starting to get to know.
Thank you, Dr. Pelt. I want to ask one last piece for you. One of the reasons why I also had you on here is we're dealing with a lot of trauma, and from a psychological perspective, there's a natural impact. A lot of families are dealing with loss. A lot of us are dealing with seeing this on TV over and over again and watching videos like this. Any additional recommendations to help to navigate through that from a psychological perspective?
One thing I'd recommend right away is to limit the amount of input, the amount of intake of the news that you take. We need some information. You need to identify a credible source of information that you can gather good facts from, and it's not president's daily speech. So other than that, I try to limit the amount of negative medical news that my brain takes in every day.
Mm-hmm.
The other thing for African American people, especially, this is not only going to traumatize us, it's going to traumatize everybody who are losing friends and family. And we have to get over the misconception that if I schedule an appointment and I talk to a therapist, that I'm weak.
Yep. Thank you for sharing that. And I'll piggyback on that. We tend to keep, as a community, we tend to keep things close to the vest. And what I would also say is right now, a lot of us are in need of prayer. And if people don't know that you're in a bad position and they need to be praying collectively for you for healing powers, then guess what? It's not going to be there. So certain things at certain times, it's time to open it up. So I'll share that as well, because we do have some prayer warriors. And guess what? I believe prayer works. So that's a segue into you, Ed. Oh, I think he's on mute again. Hold on, Ed. We're going to get you off mute. And you should be good. Go ahead, Ed.
I'm going to just say, I'm going to keep talking about this because, first of all, prayer does work, because I do appreciate every prayer that I got. Facebook, everything helps, I'm gonna tell you. But I keep getting so detailed about how I felt because I'm going back to your statement, doctor, where fat meat ain't greasy unless you hear it. You need to hear it that I couldn't breathe. You need to hear it that I had diarrhea and vomiting at the same time. You need to hear that they had to change my sheets like 3 times a day because I was sweating profusely. And all this was happening at the same time. So that's why I get so detailed about it, because if you don't hear what happened, you don't really understand. All you hear is about the coughing part. I want to tell you how it felt, the vomiting, the not being able to eat, the diarrhea, the sweating. You need to really hear what happened so that you're not going outside, or not the parents letting their kids go outside by themselves to a park and play basketball and then come back into the house. You know what I mean? So that's why I keep telling the story about, and it's not just telling the story, just telling about what actually happened.
Yeah. So, and if that's it, you would hope that that's enough, right? For people to not want to go through that themselves or put a loved one through that, to say, I'm just going to hang tight for a little bit, right? So I get it. We appreciate you being that transparent with it. In addition to the one part he didn't share, and this was one of the issues when I got a chance to talk to him very briefly, is he couldn't talk more than 15 seconds, right? So you couldn't even speak longer than 15 seconds, couldn't get to the bathroom. So people need to understand that. And that's what these doctors are also dealing with firsthand, is seeing this, each and every day. So it's just a lot, and we need to do our part. So Dr. Williams, would you like to wrap up with your tidbits?
Sure. I think one of the things that doesn't get talked about a lot, which was an experience I had with one of the patients that I saw in my urgent care, those who are out there and who have to be out there working. I treated a young lady who worked at the local grocery store. It was 2 doors down from the clinic. She worked in the deli. She's still making sandwiches. She was not given a mask. She had gloves on, but she worked with gloves all the time. When I go home, I strip down at the door. I put all my scrubs in the wash machine, take my shoes off at the door. One of the things that our current president at Meharry is talking about is not being a vector. What that means is that when you're out there and you have to be working in the public, you are also carrying all those germs back to your home. I want people who are having to work every day to know that they too need to be having some practices, just like docs do when we come home. Take your clothes off, put them in the washer, wash your hands, wash the doorknob. You're bringing whatever it is that you have to bring in because you're out there working into your home. Do not be a vector. Do not be the thing that brings us into your home after being out trying to do the right thing and coming back home from work. The second thing I would want to say is the biggest thing that we all have to work on is our immune systems. We have a fighting machine against infection out there in the world. It's called our immune systems. How do we fight? How do we build up that immune system? Taking better care of ourselves, eating right, exercise, working on our stress level, but eating right. There are things that we can do to actually make our own immune system stronger. So when these things come up, we are not the worst case scenario.
Very well said. Very well said. Thank you for that. So listen, y'all, we do have, what I'll tell you is in the thread, there are a bunch of additional comments and questions. We appreciate everybody joining us today for this very important conversation. What I would ask you to do at this point, though, is to spread the word, right? If you heard this and you saw value in it, and I can tell you from the comments that I received and text messages I've been receiving, there's a need for, 1, more of this, and then 2, people value it. So others will value it. So I'll ask that you share this information with your loved ones, with your acquaintances, and get the word out there. There's some great intake or intel that was shared, perspectives that were shared, as well as some action items and things that we can do. And remember, we are in this together, and we have got to stick together, help each other out to make it through this particular situation in time in history. So with that being said, I want to thank each of you once again. I pray and ask that everybody has a blessed day. Remember to check us out on ColumbusBlack.com, where we highlight movers, shakers, creators, and all the great things going on here in the capital city and abroad. And then make sure you check out the Mile app, that's MYLE, to make your life entertaining, which we need right now. Check out the virtual events categories, an amazing amount of things that are going on there, from online food, right? We talked about food, right? Healthy cooking. You can go in there and see people cooking and providing different meals, as well as other things that you can do while you're in the confines of your home. So with that being said, once again, stay safe, be blessed. Don't forget to pray for Maya. And once again, this is in memory of Kenneth Wright and my brother Mark Graham and his family. So I appreciate all of you. Have a blessed day. And on that note, as I always do, I'm out. Later.
All right, take care.
Bye-bye.
Thank you.